Welcome. I'm Amy Driscoll, and this is Speaking of Miami, the Miami Herald editorial board's live stream series that connects viewers with South Florida newsmakers for conversation and insight into some of our most pressing issues. Just to clarify for our audience, we're responsible for the opinion pages of the Miami Herald and operate separately from the newsroom. We hope this series will help you get to know more about our community and maybe some new ideas. We welcome your feedback about what you'll hear today and suggestions about future discussions. Speaking of Miami, vaccine has become a critical issue as we face the Delta variant of the COVID-19 virus in South Florida. We're seeing the number of new cases and worse, hospitalizations reaching peaks that are even greater than a year ago when vaccines were not yet available. The vast majority of infections are among unvaccinated people, leading some to call this wave a pandemic of the unvaccinated. And while it's easy to dismiss or even demonize those who for one reason or another have chosen not to get vaccinated, it's not simple. Americans cite a range of reasons for not getting the COVID-19 vaccine. Understanding what barriers prevent the unvaccinated from getting the shot and what might persuade them to do it finally may become crucial to fighting the Delta variant. We'd like to have an honest and civil conversation about what truly can be a life or death situation. We have a panel of 3 experts with us today, and we'll also be hearing from readers who have sent us questions or concerns. Manny Sid is the mayor of Miami Lakes. Dr. Carol Biggs is chief of nursing at Jackson Health Systems, Miami-Dade's public hospital system. And Stephen Safran is a University of Miami professor in the Department of Psychology. Thank you all for being here to discuss this very important issue. So, Dr. Biggs, we're going to start with you. As head of nursing for Jackson Health, you must have a pretty good perspective on what's happening now in terms of hospitalizations and rising cases. In the last week, Florida has broken previous records for new cases and hospitalizations. The majority of people in Jackson hospitals and ICUs for COVID are unvaccinated. What are you hearing are some of the main reasons people aren't getting vaccinated, even though billions of people around the world have gotten the shots?
Well, that's a very good question. And it's something that we grapple with every day. Just to give you a little historical perspective, last year this time, we were really in the height of COVID, still figuring out every day what it is, all hoping that one day soon there will be a vaccine. And what's troubling to most of us on the front lines is that now we've had a vaccine since last December, and we're back in the situation, especially here in Dade County. We're back in the situation where we were last year this time. So, of course, it's very important to us to find out what's the issues, what's going on. I can tell you that 96% of our patients who are hospitalized are unvaccinated. And the very few who are vaccinated and hospitalized have some type of immunocompromised situation, which, causes that. So that speaks to itself. So, of course, we ask a lot of folks, because unfortunately we even have some of our own staff members who are not vaccinated. And, the reasons range from a mistrust of the healthcare system, mistrust of the pharmaceutical industry. A lot of people still saying they want to wait and see, what happens. Not a lot of folks saying, I don't know what the long-term effects of the vaccine may be. And of course, there is a lot of, erroneous information on the internet. So we do offer a lot of opportunities for people to speak to, all of us at Jackson, physicians, nurses, and otherwise to try to debunk some of these myths. One of them I'll speak to, for example, from the Black community, is that because, a lot of people cite the Tuskegee issue that happened many, many years ago. And what we try to explain to folks, for example, with that one in particular, is that the issue was that care was denied the Black men that had syphilis. And, it's really ironic that now a lot of folks are denying them self-care in getting this vaccine, which as we know right now is the only thing that we have to prevent this disease. So this virus from invading your body. And from the nursing perspective, it is disheartening in the sense that nurses are on the front line, and the amount of care that the nurse must provide to patients who are, especially in the critical care units with COVID, it's really immense, and it's troubling to see the agony that patients go through. So we really want to get the message out there that, get vaccinated, ask the questions, whatever your reasons for not doing it yet, please, we're here to answer all your questions. So I just want to say we are here for you.
Thank you. That's a valuable perspective, and it also leads us directly into something that I wanted to bring up with Mayor Sid from Miami Lakes. Mayor, you were a vaccine hesitant person. You recently changed your mind, and you got the shot. In fact, you even posted it on Twitter on July 26th. You used your Mayor Manny Sid account, and you wrote, "I have to admit that I was extremely hesitant to get vaccinated. After attending the funerals of some human beings that I respected, watching," and you name a person's testimonial, "hearing of cases of young people from our community in the hospital. After consulting with my doctor and much prayer, I decided today was the day. Yes, getting vaccinated is 100% a personal choice. I had to share my story with you all. Even if I'm able to possibly save one life, it was definitely necessary to post." And then with the text, you posted a picture of yourself with what looked like maybe a doctor after you got your shot with your thumb up. Talk to us about your hesitancy. Why did you change your mind?
Thank you, Amy. Thank you for the invitation. So yeah, I was definitely hesitant. I was, from the get-go in the pandemic, I was out there in the community. I was exposed from day one. The entire discussion at the beginning was about seniors, was about people in their later phases of life, that they were the most vulnerable in our society. Fortunately, we saw with that variant, right, the Alpha variant at the beginning, that it really wasn't impacting a lot of the young folks in our community, but it was having a major impact on our seniors. So that's why when vaccines first came out, the entire push was to get our senior population vaccinated as soon as possible. So when it became available to my age group, I'm 37 years old. I did some research. I was definitely hesitant, specifically when we saw that it's still under emergency use from the FDA. And fortunately, we know that the FDA, hopefully very soon, will be approving it fully, which I know is going to have a great impact on folks that are still hesitant. But one thing that I did, and I highly recommend it, I went out, I tested my antibodies. I had no antibodies. And seeing the Delta variant, when I sat down with my doctor, I called close friends of mine, nurses, other ER doctors, my pharmacist. They all told me, Manny, protect yourself. This Delta variant is no joke. Make sure you get that shot in, that vaccine in as soon as possible, so you can start building up those antibodies, because we don't know how your immune system will react to this Delta variant. So I tell folks that all the time. Don't read what you see online. Don't read what you see on Facebook or what you hear. Talk to the people that you trust. Talk to your doctor, who you trust every day for your care. Talk to your pharmacist that you trust. Talk to your neighbors that are nurses, that are doctors. And that's what really gave me a lot of comfort. But yeah, and it was very important for me to share my story. And I know it's already made a difference in a lot of people in their decision-making process.
And you actually told me that you had consulted with some doctors that you knew personally from your childhood or early in your life. And why did that make a difference to you? Why was that a particularly helpful thing to do?
One of my good friends is a local ICU doctor. I've known him since I was 5 years old. Is Dr. Emmanuel Hernandez. He's treated many COVID patients. He actually treated one of our police officers here in the town of Miami Lakes. I know they both gave me permission to utilize their story. And when I called him and he told me, Manny, I'm seeing more and more young people in the hospital. I'm seeing more and more young people being intubated, folks with no underlying conditions. And he told me, get it. You should definitely get it. You're a leader in our community, and share your story, because folks trust you. So when I had that discussion with him, it made a world of difference, because it's somebody who I trust. And more importantly, it's somebody with practical knowledge of the situation. Many times if you turn on all the entire news cycle, we're hearing from folks that aren't really treating people. I mean, like Dr. Biggs. I think Dr. Biggs is an incredible spokeswoman for the coronavirus in terms of vaccination, because she's in there every day treating people. And the same thing as my friend, Dr. Hernandez. So when I called him, I know that he's treated thousands of corona virus patients, and that made a major difference. And again, it's somebody who I trusted, somebody who I know that's taking care of people that are friends of mine.
And I want to bring Professor Safran into the discussion now. Professor, you're a psychologist working in HIV and mental health research. And in particular, you studied people's adherence to medical advice even when the medicine is considered life-saving, or when it can prevent others from getting infected. People don't always adhere to their medical regimen in HIV. What kinds of parallels do you see now with the COVID vaccine?
Hi, yes, thank you for having me, and I'm enjoying hearing from other experts and Mayor Sid. So, yeah, there's a lot of parallels. One thing that I love that Mayor Sid just said is the issue of having accurate information, because accurate medical information is really the foundation. I call it's necessary. It's not sufficient for health behavior change, but it is really the foundation. That if you do not have accurate information, you're not going to be motivated or utilize any behavioral skills that you have to change with respect to health behavior. We know that from now my 20 years of working in a different global pandemic, which is HIV, but even in things like diabetes, hypertension, exercise, substance use, any of the health behaviors that require people having to kind of weigh pros and cons of decision of making the decision, and then going and engaging in the health behavior. And what we see both in HIV and also in COVID is that there's a lot of misinformation out there. And again, Mayor Sid was talking about this, and so was Dr. Briggs, that just when you go to the internet or you go out there, you'll see basically so many different theories of what it is, or does the coronavirus even exist, or is it really as bad as it seems, or as people are making it out to be. And frankly, politicians politicizing both with HIV and with COVID, that, kind of saying things more for political reasons instead of public health reasons. And that can really undermine the public's trust in science and in what real medical professionals say. So the biggest thing I would say, I mean, the most important thing is the issue of information. But that's not the only thing. I mean, another thing that is really important is that when you're trying to convince someone to take the vaccine or wear a mask or engage in public health related behaviors that are both protective for yourself, but also for the community, like yelling at someone or doing finger wagging and things like that, we know from HIV just does, first of all, it's not helpful, but it just doesn't work. Like you can't, if you're in the airport and you see someone not wearing a mask, wearing, "Hey, I'm not vaccinated," and you start, yelling at them or calling them names or something, that's not going to get them to be like, "Oh, okay, now I'll go get vaccinated and wear a mask." What we find is that really trying to elicit from the person their reasons for wanting to engage in these kinds of behaviors, whether it's altruistic, whether it's self-protective, whether it's for their family, but doing a type of counseling that we call motivational interviewing, which is a non-judgmental type of counseling to try to get people to resolve any ambivalence that they have about changing. So some people might be ready to change, and in that case, you can really help them with skills to find vaccines or transportation or whatever barriers they have. But someone that's not willing to change, you're not going to be providing skills or giving them a ride. You're going to be more asking them about, okay, well, what's important to you about this? What makes you hesitant? What makes you think that you might want it? And hearing those answers and helping them, like I said, resolve their ambivalence is probably the best way to get people to maybe not get the vaccine the next day, but to have them go through the process that slowly they'll hopefully be hearing more accurate information, reaching out to more trusted medical professionals that they trust, that are basing their opinions in science, and then making their own accurate decision.
And just to follow up on that a little bit, you started down that path of discussing, like, what would that conversation actually sound like? Could you tell us? You sounded as though you were saying ask questions rather than make statements. How would you walk someone through it if they have a loved one who is maybe on the fence?
Yeah. So again, exactly. I wouldn't necessarily start providing information to them to try to get them to change their mind. First, I would ask a lot of questions about what their hesitancy is about, and also be empathetic when you're listening to them and validate what they're saying. So if someone says something like, I just really don't think vaccines are around long enough, and I'm concerned about side effects. Your response might reflect back what you just heard, instead of starting in with like, oh, the vaccines are fine and the side effects are minor and you're going to be fine. That might not go over as well as really making sure that you understand, making sure that they know that you understand what they said. So you might say, yeah, a lot of people do have those concerns. Sounds like you're really worried about side effects. What are your worries about that? And then, well, where do you find information about side effects? What do you think of the fact, and then instead of saying people don't get side effects, what do you think of the research that shows that most side effects goes away within 24 to 48 hours? Something that's a little bit less that the person will think that you're judging them.
Right. Understood. And that actually leads very well into the next. We have a little video clip we wanted to show of one of our members of our audience who has a concern about medical issues that she has. Maybe we can play that clip.
My name is Dion Cease. I'm 61 years old. I am a retired county employee from Miami-Dade County. I am also not an anti-vaxxer, nor am I a conspiracy theorist. So far, I have been skeptical about getting the COVID-19 vaccine because I feel like it's so new that it hasn't been studied long enough for long-term side effects. I'm nervous about getting blood clots, possibly. In addition, I also have Wolff-Parkinson-White syndrome, and I am not sure how my heart will respond to the vaccine. I did talk to my cardiologist about getting the vaccine, and he recommended that I get it. However, I feel like he gave me a response based on no data. He couldn't tell me if anyone had been studied who has Wolff-Parkinson-White and what the results were. Hopefully some medical person can persuade me in a way where I will feel comfortable to get the vaccine so I can feel a lot safer.
She is an example of a person whose concerns, I think, are quite understandable. She is not a conspiracy theorist, as she said. She's trying to inform herself. First of all, Professor Safran, that with her, you would recommend talking to her and asking her some more questions, I'm guessing. Is that correct?
Yeah, and I think, I wouldn't necessarily have the answers to those questions.
Right.
I think, that it would be more trying to guide her to find places where she could get her questions answered in a way, like she said, where she trusts the response. So if that doctor, was just kind of saying like, oh, I think it's going to be fine, but like she said, there aren't maybe data with individuals that have her exact medical condition, that does make it a little bit hard to make a decision. So I would really validate that, but then also look into information about how usually the side effects do only last a couple of days, that there is a lot of data to show that when people do have reactions, that usually medical professionals are able to handle those reactions. Like, how you have to sit there for 15 to 20 minutes. Usually that's when the side effects or any kind of negative reaction would occur. And if it's like an anaphylactic reaction or something like that, there are a lot of medicines that can help with that. So if there's a way that she could look into that kind of information, and in addition to the specific information about her own medical history, I think hopefully that could help her.
You know, I would also add that by now we've had a few billion people who have been vaccinated. So at this point, I'm sure there probably would be some data at this now with folks that have had, various conditions who have been vaccinated. Just like, prior, almost let's say December when the vaccine came out, a lot of women who wanted to become pregnant or were pregnant were very hesitant, understandably, in getting the vaccine. But by now, we've had enough time have passed. It's been way over 2 years from women who were involved in the research studies, as well as women who have received the vaccine since and have had, went on to have healthy pregnancies, healthy babies. And then you would want to contrast that with, unfortunately, a lot of unvaccinated women who have had very negative outcome because they were unvaccinated and got COVID. So I think, if I was having a conversation with that person, I would help her find, look into the data, the CDC and WHO to see, are there, patients who have had, the heart conditions that have had the vaccine and how they did. And the thing with COVID is that we do know that a big issue with COVID are blood clots. It's not just death; it's also losing limbs. What now we're calling long COVID, where people the COVID itself has resolved, but there are a lot of long-standing issues, pains in the joints. Again, I'll say blood clots, which is really a big deal. Strokes, heart attacks, as a result of the COVID virus. So I think, you want to weigh the risk and the benefits, and those are some of the conversations I would have with her.
And thank you for that. And Mayor Sid, you talked about the importance of having the personal conversation. And also you mentioned to me that you didn't think it worked when people from, on high in Washington or someplace else talk to, try to give people the reasons as much as it does if you have a personal connection with them. How important is it to be able to have conversations with people where you talk about it rather than shout them down? And I'm assuming that you've probably had quite a number of those conversations at this point.
And I've had many of those conversations. And I loved when Dr. Safran said, we have to be empathetic. And he's absolutely right. So that's exactly what I do every time I talk to somebody who is hesitant. For example, one of the hesitancies that I hear all the time is that this is an experimental vaccine. That mRNA is a huge experiment currently. Well, that's not factual. We know that the mRNA technology has been worked on for over a decade, and it's been worked on for different Zika and SARS, but things that ended up not becoming as big as a pandemic as this one. So we do know that it is safe. So one of the main things that I continue to see is that type of hesitancy. But I know, based on the polls, that over 50% of people who are hesitant today, once there is full FDA approval, that will give them a lot of the comfort to get the vaccination. So we hope we see that within the next 3 weeks. But the main thing that I do when I sit down with folks is being empathetic, because I was there. I was in their shoes just 3 weeks ago, where I was hesitant. I had loved ones telling me, but that's the main thing I do all the time. And sometimes if they don't have somebody who they can trust, I'll volunteer to ask one of my doctor friends, to ask one of the nurses that I know, one of the pharmacists that I'm close to. I go, look, just make a phone call. This is somebody who I trust. These are my personal doctor, my personal pharmacist. These are nurses that I work with here in my community every day. And I do that for people so they can hear directly from folks who are helping patients. And I think one of the main issues that we have is a trust deficit. Too many times you turn on the TV and you hear from different pundits or different folks who aren't really in the clinical aspect of this, like Dr. Biggs. And we need more of those voices out there. So I know when I heard directly from people treating COVID patients, that's what gave me more comfort than anything else.
And I just wanted to follow up on that quickly and say, you talked about the empathy part. Did you before this feel as though people were judging you? Did you feel that? I
mean, nobody really knew that because I never advertised it, right? And I more than anything, you kind of heard both sides. You would hear from people who would say, hey, don't get the vaccine because of X, Y, and Z reasons. You would hear from folks that said, hey, you need to get it immediately. So the reality is that really didn't weigh on me. What weighed on me more than anything was sitting down with my doctor. When I sat down with him and he said, Manny, go get your antibody test. He went with me. He checked it. You have 0 antibodies. You need to protect yourself. When he said that, I got on the phone and I called other folks in the medical field who are treating COVID patients, who I trust, and they all told me the same thing. So that's really what helped me. The reality is, and this is what I tell folks all the time, forget about what people who aren't in that practical aspect, who aren't treating COVID patients are saying, because there's a lot of misinformation out there. All you have to do is log on to Twitter or Facebook, and you'll see a lot of different people who think they're experts, but never treated a COVID patient. So yeah, while they might be my friends, their opinion really doesn't weigh on me as much as my doctor, who has treated 1,000 COVID patients, my friends who aren't currently in hospitals, their opinions really outweighed anyone else's.
I think someone else was going to jump in.
Yeah, I just one thing, because this is the Miami Herald that we're talking with. I think different communities have different things that are important to them in terms of barriers or facilitators of health behavior change. And one other thing that we've been finding in HIV, I came to Miami 6 years ago from Boston, where I worked at Mass General Hospital in the Harvard system. And there, this wasn't as much of an issue, because there I feel like when we'd make recommendations to people, like it would be easier to get people sometimes to follow a medical or mental health related recommendation if we were to make these recommendations. But in Miami, we really are finding that having personal connections, someone else said that as well, like the personal connection is so much, I think, more important than it is in Boston, that people will make decisions. I've noticed, not just for health reasons, but just also like if you're going to try to find a contractor for your house, or, someone to fix your electricity or something like that, like having a person, or go to a health agency, having someone that has done it, that has gone to that agency that you are close with, really makes a difference. And so the other thing is, maybe look to to people out there, look to your peers who have had the vaccine and ask them what their experience has been like, because I just think that that's like I said, we're finding that that's a really important determinant of, for example, uptake of mental health treatment in people at risk or living with HIV in some of our studies.
That's a very interesting point, and I do think that's true about Miami. Personally, I always ask for other people's recommendations on things for fixing my house included. So, and doctors. So I think about that. It is a personal thing here. Maybe it's a different way of looking at the world. And that brings us to something else that I wanted to bring up. We have a reader who said, responded to one of our surveys, expressing his concerns about the vaccine being too new and not approved yet by the FDA, as we've earlier mentioned. He claims he's a healthy, educated person who doesn't trust the way the government rolled out the vaccines. And then he said he felt unique from other concerns because, as an African American, I don't trust the healthcare system, as we've seen countless times. And then he talked about getting substandard care. Dr. Biggs, could you talk about the low uptake in the Black community for the vaccine, and why you think that exists here in Miami?
Yeah, as I briefly mentioned before, when I speak to a lot of my people, the vast majority cite the Tuskegee Institute study from back in the day, where when Black men had syphilis, and once we found out that penicillin cured it, they were denied the treatment because the health industry at the time wanted to see what would happen, how somebody would die of syphilis. So because of that, that is a really big, still, even though it was decades ago, it's still a very strong, it holds a strong place in the Black community. So what I really try to help them understand, understand is that we were denied care at that point. The Black men were denied care. Here we have the vaccine, that it's the same vaccine being given to everybody. This is one of the first few times where the treatment is 100% equitable across the board: white, black, green, blue, purple, rich, poor, middle income. It's irrelevant. The same vial, you get 6 doses in a vial. The next 6 people in line are going to get that medicine, right? So this is one time where it is totally equitable. So we're at this point, we're doing to ourselves what was done to us. We're denying ourselves care that's available. So I really want to emphasize that, and I really do have that conversation that this is the same treatment for everyone. What I'm more concerned about is that it is true, there is an issue with disparity in care with in regards to colors. That is factual. That's evidence-based research, right? So my when I speak to people, I say the vaccine is the same. It's going to be equitable. My worry is when you go to the various different hospitals, I'm not sure if you go in with COVID, if the treatment might be the same. This is where you might get into trouble. So let's use the preventative measure and take the vaccine so that you don't end up in anybody's ER or worse yet, ICU. So those are some of the conversations I have in order to address the Black community.
But the Black community in Miami also is not a monolith. We have, Jamaican Americans, we have Haitian Americans, we have African Americans. Are there different concerns in different groups?
Yeah, that is interesting. Yes, that concern is primarily the African Americans. I've been on, of course, the Caribbean radio, also speaking to my Jamaican community as well, and my Caribbean community. And a lot of the issues there is that the vaccine was developed too quickly. So as Mir said already, discussed, is that this messenger RNA technology has been around for a few decades. Remember, COVID-19 is a coronavirus. The common cold is a coronavirus. The flu is coronavirus. We've been studying coronavirus and messenger RNA for quite a long time. The reason why this was able to come in quickly, as people may believe, is that we've been studying it for a long time. And think about it. This is the first pandemic in over 100 years. So every country, every scientist, pretty much, every pharmaceutical industry was all working on the same thing at the same time. So it wasn't that it was quick, decades, and then everyone doing it at the same time. So, we go through all of those conversations. Then we have some other communities that believe that the vaccine that they received to come into America is, they heard that protects everything. So we have to go through and debunk that myth as well, and actually look at the vaccine that you were given to come into the country. What was it covering? What viruses did it cover? It did not cover the coronavirus, COVID-19. So it's really, just having those conversations. And again, it's not that one conversation is going to change anybody's mind, but I always leave everybody with, and let's talk about this again some more, because I really want to help you to understand and feel comfortable about your decision. If you still insist that you're not going to get the vaccine, when I ask you why not, you should be able to say exactly what are your reasons, not just, well, because I don't think it's going to, work or what have you. So yeah, the conversations do vary depending on who we're having the conversations with.
Thank you. And let's talk a little bit about personal choice. Mayor, you made sure to mention in your social media post that you believe that getting the vaccine should remain a personal choice. Yet you've also been very outspoken that people should get the shot. And I just wondered if you still believe that, if given that somebody's personal choice could actually affect others. What are your thoughts on that?
I definitely do. I as much as I believe that folks should get vaccinated, I definitely think it's a personal choice. I'm not in favor of vaccine mandates. Maybe we'll see how everybody's perspective changes when there's full FDA approval. But it is definitely a personal choice. In my book, I can tell you, and I think Dr. Biggs touched upon it. I mean, you still see hesitancy within the hospital. So if we start mandating these in some hospitals or not in other hospitals, you're going to see a rush of folks who are hesitant moving from one hospital to the next. And we're seeing that in the airlines industry. There's one airlines that mandated vaccines, and now you're seeing a major move. It's happening in California. I think now they're requiring teachers to get all vaccinated. Look, I just don't think that's the right step in that direction. I don't think we're at a point where vaccine mandates are needed. Treatments are getting better. Look, one thing that I tell folks all the time, it is the vaccines are under emergency approval for the FDA, but so are some of the treatments that if you do end up in the hospital, so are some of those treatments. They're under emergency approval by the FDA as well. But yeah, I really don't think we should move in that direction of vaccine mandates at the moment or possibly ever in the future. I think it's definitely a 100% a personal choice. And if private businesses want to do that, if a private hospital or other hospitals, but I think as a society as a whole, to say that everybody in our country needs to get vaccinated, I don't think that's a goal. And the reality is it's changing the message, right? When we were talking about herd immunity at first, we were adding in the percentage of people vaccinated with the percentage of people that had antibodies, which we know that there are a lot of folks that have natural antibodies who've had COVID, maybe asymptomatic COVID, and have gone through it. I know there's people who I speak to on a daily basis who say, hey, you know what, maybe I'm not going to get vaccinated. I checked my antibody levels. But yeah, I'm personally not in favor of any vaccine mandates, and I still believe it is definitely a personal choice.
And Professor Safran, you and I had a short conversation about that as well. And you talked about compared it to drunk driving, I believe. It's legal to drink, but if you get in the car and drive and you can harm other people, that's considered illegal. What are you? I mean, it sounds like Mayor Sid believes that enough people are going to do it so that we won't have to force people to do it and still be able to function as a society. What is your thought on the question of personal choice?
Yeah, I mean, I do think it's complicated, and there are other vaccines that are mandated for school children and for certain situations like that, and certainly, it's hard for me to think about, for example, like going on a cruise or even going on a plane when people are either not vaccinated or not wearing masks or not recently tested. And I guess this isn't quite what you're asking, but if there were more ubiquitous testing available, if it were easier to have people just have rapid tests all the time, I could see potentially maybe not needing, whatever the statistics are, 80 to 90 to 100% of the population to get vaccinated. It is a group effort, though, like to get to that herd immunity. I mean, my understanding is that people that get COVID are not fully protected as much or as long term as you would be if you had the vaccine and kept up with if they eventually need booster shots or what have you. But the testing is also an issue that there are alternatives where places that have mandated vaccines, a lot of times the opt-out of the vaccine is frequent testing, whether it's weekly, whether it's every few days. And if you're going to be in group situations, like if you're a healthcare provider or you're a school teacher or in high-risk situations, that really if we are going to try to control this, we have to really not only vaccinate people, but also people need to know just like HIV, know their status and act, accordingly. And I wish there was like a way that you could just, breathe into a straw or something where, within 5 or 10 minutes, and then, let's say you're going to the supermarket or you're going, you're a teacher, you could, get a rapid test or show your vaccine, show a vaccine card or something. And then no one's forcing you to get the vaccine. Your movement isn't restricted. There's not, this whole authoritarian component to it, but instead it's another potential way to try to get control from the, balancing the public health with the individual choice.
Right. Understood.
If I can just mention
Sure.
another take on this is that viruses mutate, right? That's what they do. And unless we deny the virus a host, because if the virus does not have a host, if it does not get to go into a human body, it can't do anything. It'll literally die, right? It'll literally go away. And this is the issue with vaccine. You're denying the virus a host, and now we have the Delta. Before the one last year, the Alpha Beta, that's pretty much gone. You don't even see that anymore. About 87% of what we're seeing now is this Delta virus. We don't know what that next strain may be. There's a Lambda down in South America right now, and we don't know, as the virus mutate, we don't know what the very next strain may be. We don't know if it'll mutate into a strain that's not covered by the vaccines that we have now. So if we don't do something to halt this thing sooner than later, we're really going into the unknown. So we really have to think about that. Do we want to continue to live like this, with this virus just continuing to rule our lives instead of us taking control by getting the vaccine so that we can halt that virus and eradicate it?
Well, let's follow up on that a little bit too. I know that Jackson Health has actually struggled with getting everybody vaccinated there, even though they are healthcare workers, and particularly nurses have not been, the number of nurses, percentage of nurses has been, I think it's in the 58 to 60%.
Right.
Although there was a push last week. How do you deal with that? What are your thoughts on that? How can nurses who are treating COVID patients try to help educate others? Give us the perspective on that issue.
Yeah, trust me, I grapple with that myself. And when I speak to some of my nurses, a lot of it, they're cultural things, a lot of, as we remember, they're nurses in the hospital, then they go home to their own communities. And if there is a lot of hesitancy in their community and their home, their parents, grandparents, they themselves sometimes go back and forth with that themselves. So we're doing the same thing. We're having one-on-one conversations, and we're very happy that we've been doing pop-up vaccine stations at our hospitals for the last, this is I think week 3, and we'll continue. And more, we're getting more and more people to come on and take the vaccine. So we're going one by one as well. That's why this is something that I'm passionate about, because I know that within my own healthcare system and part of my healthcare community, that we're not where we should be as well. So that's why I totally understand this hesitancy, and totally understand that it's not a lack of knowledge, but a lack of having. I think some people is just a listening ear to speak to. This might sound a little crude, but one person, I literally said, when we were going through all the reasons, and she ran out of reasons, and I said, look, I care about you too much. I don't want to see you in one of these beds. And then she stopped and looked at me like, okay. I said, can I walk you down to the vaccine station? And she actually took it. And I heard from another one of our CNOs that she took a couple of people by the hand and just say, look, just come with me. I'm going to walk with you. I'm going to stand with you while you get the vaccine. I will stay with you while you go through the 15, 20 minutes to make sure you didn't have a reaction. And they actually took it. So we're doing whatever we need to do to get our staff to protect themselves, their families, and their community.
And I think there have been a number of people who are in that wait and see mode, where they thought, well, older people can get it, and then other people can get it. I'm not at risk. I'm just going to wait and see how it goes. But I think we've now reached the point where that's maybe not going to hold for too much longer, especially with potential FDA approval. And that's something that Mayor said you brought up. So how real is that, do you think, for people, the question of FDA approval, especially if they are questioning the government's advice already, but then they want the government stamp of approval on that?
I think it's very, very real. I mean, we've seen that close to half of Floridians still haven't gotten vaccinated. And we've seen the poll numbers that once there's full FDA approval, that is one of the main hesitancy that folks see. Once the FDA says, you know what, here's a stamp of approval, we see that 50%, close to 50% of people that are hesitant will get the vaccine. And that in Florida, that means we'll see our numbers grow to maybe 75% of our entire state getting vaccinated once that happens. But I think that's incredibly important because at the end of the day, when we talked about emergency approval, I really think that's one of the main aspects that had folks nervous about this, hesitant about this. We do know that it's safe. We do know, like Dr. Biggs talked about, this technology has been worked on for a very, very long time. And this is why it got used now, because it got rolled out now because it's a pandemic. We haven't had one in over 100 years. But once that FDA approval hits, all the poll numbers show it, you're going to see a major shift, and you'll see Florida's numbers grow to 75, 80% vaccinated. And one thing I tell people all the time, and why it's important to get vaccinated, especially if you have no antibodies, is to ensure that it gives us time to maybe later on where we see antivirals, similar to a Tamiflu. I know that's being worked on as we speak. There's billions of dollars being thrown into R&D to work on those antivirals, where maybe in the future, if somebody gets COVID, all they have to do is take a pill and that happens. But that doesn't exist today. So how do we protect ourselves? By getting vaccinated. And once that FDA approval hits, which we've heard it might happen within the next 2, 3, 4, 5 weeks, that's going to be a game changer, not only here in Florida, but throughout our country.
And it sounds as though you've had those actual conversations with people about the FDA. Who have you talked to? Are you talking to your constituents? Are you talking to your friends?
All the time. I talk to once the story got out there and once folks started hearing about this, I was getting phone calls left and right, and people would ask me about the vaccine and why they're hesitant. And they all tell me, I've had a handful that many people that have gotten the vaccine after I got it, but there's still some folks that said, you know what, Mayor, I'm going to wait for full FDA approval, which it goes to show, while folks are nervous about the vaccine, and while folks might say, you know what, I don't trust the government's emergency approval of this, but I think the vast majority of Americans, like the vast majority of Floridians, once they see that FDA approval, it's a game changer. And the people who I'm talking to who are still hesitant have told me just that.
Yeah. Now you are a Republican, and I didn't want to bring politics into this particularly. I still want to keep it mostly out because I want us to talk about the actual reasons. But is that something that you think gives you more standing with people?
I don't think so. I think, I just won re-election unopposed here in our community. I won by the largest margin. I have Democrats, Republicans, independents that all support me. I think more than anything, I'm a trusted figure in the community. Somebody who people said, the vaccine really is not a partisan issue. While maybe there's some folks throughout Washington, and we saw it in presidential debates and on both sides, we saw Democrats and Republicans utilize the vaccine as a political issue. But we know that this pandemic and this vaccine should not be politicized. And the reality is, on the ground with folks like Dr. Biggs, Dr. Safran, people who are trying to help folks, it's not political at all. But I can tell you, for me, more than anything, being a trusted voice here in my community has made a difference in those folks that have been hesitant. And we need more trusted voices out there to talk about that. More elected officials on all sides of the aisle who've been vaccinated to share their stories. I know there's a lot of people who are hesitant. I didn't have to share my story. But I did, especially one of my council members here in the town of Miami Lakes. His mom, who I've known since I was 5 years old, passed away from COVID. When I got the vaccine, I called him, and he told me, he goes, Manny, you should consider sharing your story because you might change people's minds, and exactly that has happened. But a lot of the folks that still don't want to get it, they point towards that FDA approval, and the poll numbers show it.
I'm going to go to a reader comment that we have. One of our readers, Tom, wrote to us explaining that he had already had COVID and knows for a fact that he has antibodies. In his words, why would I risk taking a vaccine for something I've already had? He claims to be someone who's healthy in his 50s, no other health conditions. He made it clear to us that he's not someone who's adamantly against the vaccine, but he's against shaming and humiliating others who have the right to make their own decisions about what they want to put into their bodies. Professor Safran, I wonder if you could address the whole question of shaming people, and specifically when it comes to the idea of antibodies. Is that, if you call people out on a question like that, and I know you've mentioned this before, you're probably going to get the opposite response of what you're asking for, right?
Yeah, sometimes what I say is I ask them what they think about the research that shows X, Y, and Z. So, what do you think about the research that shows that people that recover from COVID are not fully protected indefinitely? And there might be, again, referring him to trusted professionals or people for that specific piece of information. But I do agree that shaming someone or yelling at them, like I said before, isn't going to change the opinion. I think it's more trying to find out from them, what are their values? What are the things that are going on for them that would want them to not only protect themselves, but also engage in this common community goal that we all need to engage in order to, as the other two panelists said, in order to get through this, because we're not going to get through it. If things keep going the way that they're going, we're not going to get through it. But if, I really hope that Mayor Sid is right, that, the FDA will review all the data and have it not just be emergency only. And then I really hope that piece of, I guess I'd call it a social norm, if it, in some ways, that if the FDA says it, that people will now feel a little bit more comfortable about getting the vaccine and will do it. I hope that helps people engage in this common goal of just somehow, someday, not too distant future, moving through this epidemic. But we are, as a community, it's one of these public health things that we have to work together in order to get through it.
Thank you. I think we have time for one more question, Dr. Biggs. I'd like to end with you, and it's about children who are set to go back to school soon. A lot of parents are facing some very difficult choices now. This particular variant has been harder on kids, a lot more kids who are being hospitalized. Are you seeing any change in people's attitudes about their own vaccines, knowing that the variant has spread, particularly among the unvaccinated, and now children are the ones who are going to end up paying some of those prices?
Well, I think that's the one commonality everyone have when it comes to children. Everybody step back and go, wait a minute. This is realer than, more real than we think, because again, originally started with the elderly, and now we're seeing more and more younger kids. The trouble is kids right now, 12 and older, can get the vaccine. So we have to speak with our parents and educate our parents on the importance of getting the children the vaccine. I myself have had my teenage grandchildren, excuse me. I'm sorry, vaccinated. But we have to work with our parents, with our teachers, to ensure that for our younger kids, 12 and under 12 who are not able to be vaccinated, that they do have to wear the mask. We know that, all those chicken pox, a common cold, everything, most of the time when an adult gets it because the kids brought it home from school. So this is now proliferating amongst our children. So we do have to make sure that adults, even if you don't want to get vaccinated for yourself, please do it for your children. You don't want to give your child COVID virus. And while your child might be fine, we'll take it to school and spread it amongst all the other children. So that's one piece. The other piece is please, 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 parents, please allow your children to wear a mask when we go, as school is starting back, because we do know that the mask will protect. We do know that this Delta variant is vicious. The previous variants, you had to be unprotected, unmasked in somebody's presence, 10, 15 minutes for it to get it. Now this is as simple as the common cold. Just being in the presence, unmasked for a brief amount of time, this Delta will attack. So this, I really want to get that out there as kids go back to school. Those who are eligible to be vaccinated, please speak with your pediatrician, and get them vaccinated. Those who are under 12, ensure, and even those who are vaccinated, I don't want to say please continue to wear a mask. But do let them wear a mask and do the social distance and wash hands. None of those practices have changed. So again, please.
All right, I think we're going to leave it there. That's it for today. So speaking of Miami is our program. We please support local journalism by subscribing to the Miami Herald. Go to miamiherald.com/subscribe to check out our latest offer. Questions for our next Speaking of Miami, please send them to us using the email address heralded@miamiherald.com and Speaking of Miami in the subject line. Dr. Biggs, Professor Safran, Mayor Sid, thank you all for an enlightening discussion. Thank you for watching, and I'll see you again at our next Speaking of Miami.